Well, I think the trigger was in the late 1990s and early 2000. And I was appointed the chairman of the senior medical staff at Royal Melbourne Hospital, where I was working at the time. And I was a neurologist then. I've been working as a neurologist for many, many years and very happy in that role. But while I was the chairman of the senior medical staff, there's all sorts of ways you can take on that role. And I took the opportunity to get to understand how the system worked and how the health system worked. And I got quite interested, and I could see there was more to the health system, just rather than just the doctor and the patient, which is a very important relationship, of course. But I did get interested in the bigger picture. And so then in the early 2000s, there came up an opportunity to take on a role as a divisional director, a part-time role. And I took on the role that nobody really wanted, so that's how I got the role. That's how you often get your first gig, I think. So I took that on, as well as continuing with neurology, and I enjoyed it, and I liked it, and I got interested in it. And so really opportunities went from there. And I realised pretty early on in that phase that I didn't want to be a divisional director forever, and I didn't want to be a chief medical officer forever, which I went on to do, and I'd like to be a CEO. And so I thought, well, I had to fast track somehow. So I went off and did an MBA, and then eventually I was appointed to the Children's, and now back here at Royal Melbourne Hospital. So it sort of came over, it was a gradual thing, but it was a deliberate decision, and I have no regrets. I always think it gave me two careers, if you like. So I think I've been fortunate in that sense. Well, I think now is probably the biggest challenge I've ever faced with COVID, and not so much today when it's it's reducing in activity, but certainly in the peak of it, we, as you no doubt know, in late July, early August, we had a peak of COVID at our hospital. And very distressingly, we also had healthcare workers in our hospital who were positive for COVID, and a lot of people who were required to be furloughed. And I think the furloughing of staff, being isolated for 2 weeks, is much more dramatic than we would ever have thought. Has quite a negative impact on their mental health, their well-being. And so I found that very challenging managing the pandemic, but then facing up to it and managing the issue of the staff, which was quite distressing. But it's improving now. But that has been probably the most challenging. There's been plenty of challenges in my career, but I'd have to say this pandemic has been the most challenging that I've faced. To manage it, I think you've got to be resilient, to be honest. I think you do need to be agile and flexible, whatever words we want to use, but adaptable to the changes. You've got to cope with uncertainty. Because that's what there's been, and we've had great advice from the department, but it kept changing and changing, not for the sake of changing, but because new knowledge came out, and so there'd be new steps and new policies, new procedures we'd put in place. So it was all consuming, and it still is all consuming in terms of volume of work. It's that uncertainty that's difficult, and then of course, you need to bring the staff with you, and it's the staff who are the frontline workers who come every day, show up to work every day with uncertainty in their own personal lives, uncertainty about the future, and uncertainty in the workplace. And I think that was the challenge that we had to face. And I chose, and our executive, we chose to be on site and to lead here on site at the hospital. I know some people might be critical of that, but I think I couldn't work out how I could expect staff to come to work every day if I wasn't going to come to work every day. So that's how I saw it. And I think being visible and being about, although to a very lesser extent than we normally would be, but still being about, is, I think, was clear, a message I hoped that the staff would know we were with them and there to support them. I think it's now, but it's going to be the absolute future. Interestingly, we had the privilege of putting an electronic medical record, an enterprise-wide system across all of Royal Melbourne Hospital, together with the Peter Mac and the Women's, and on the Royal Children's Hospital system. So the 4 hospitals here in the precinct are now on the one system, the one instance. And so there's communication about patients across the precinct, which is fantastic. We went live just at the peak of COVID. So, and that was on the 8th of August. So it was a very challenging time, but it was successful, and it is successful. And that's the first big step forward in being a digital health service. But I think digital has an enormous role, and we've just seen it in the last few months through COVID. Some of the digital models of care, which I had hoped we would take on board, but we struggled to before COVID, have actually just developed enormously. So telehealth is an absolute example of that, but I think there's much more we can do. I think there's home monitoring, so home-based care is going to grow, and supported by digital is going to be a big change in the way we deliver services. Not all services, of course, but there's many patients who could be managed very safely and adequately and appropriately, and probably in their best interests in the home rather than in the hospital itself. I think there's the other issues is the use of digital, just like we are now, using digital for meetings and for communicating with each other has worked remarkably well. And what I've noticed is educational sessions or large information sessions with our staff and interactive sessions with managers and all staff, we've had much bigger numbers, and it may be partly because of COVID and they're more interested and more feel they need to be connected, but they have been much more connected. And I think people feel safer on a digital platform, and they can do it from their home, they can do it wherever they might be, and so it's very convenient. Multidisciplinary meetings for the clinicians has worked very well using a digital platform. Grand rounds, we've had huge numbers attending grand rounds, whereas when it was physically, we never thought if you could do it any other way except physically. So I think there are many ways that the digital platform is going to change how we deliver services and how we work together. Working from home, I'm sure will have a place. Probably not as much as it's having at the moment, but I think it will absolutely have a constructive place for the working model going forward. Well, it's early days. We've only been live really 5 weeks now, I think it is, but so we don't have all that data yet. But what I do know is from the EMR, we can get a lot of data about safety of care, much more than you could before. And secondly, the program itself improves the safety because there's a lot of decision support we built into the program. So that improves the safety of patient care. There's a lot of checks and balances about medication, which improves medication safety. So there are processes which just, you can't keep going until you address those. So that improves the safety of the care we give our patients. The other is that it also tells us where the blocks are, the barriers, if you like, in patient flow across the organisation, from the front door, the emergency department front door, to the back door and to discharging. You can work out, because there's a lot of waiting for that happens in a hospital. We know that, we do audits and we know it. But to have the data in real time, which we know what is someone waiting for, if there is a waiting for component, and rather than progressing care, what are we just waiting for to be able to move on with the care that we need to deliver? And so identifying that, having the data, clinicians like data, otherwise it's just anecdote, I think can help us drive improvements. So I think it's going to have a significant impact on understanding the business, so to speak, understanding the flow and what we can do and systems we put in place to try and improve the flow. Well, I think everyone is trying to address, be mindful of, and see the pluses and advantages of acknowledging diversity and embracing diversity. So, and it's changed a lot. Certainly, in 20 years it's changed dramatically. 10 years it's changed quite a lot. So the changes, I think, are that we're open about it and address it, and we acknowledge that the differences in all of us make us unique, make us a plus, and make this hospital we're talking about here at Royal Melbourne Hospital such a wonderful organisation with 10,000 people, and many people are very different. There are some people who are very similar, but there are many who are very different, and they all bring a different aspect to the organisation. But the other is, of course, patients are diverse too. So if we don't have a diverse workforce, then we are going to struggle to be able to respond in an appropriate way to our diverse patient population. So the needs of patients, the wishes of patients, what's important to a patient is very different in one group than it is in another, and in individuals. And I think as a profession and as a healthcare professionals, I think we have struggled a bit with that. We've struggled to understand that, but I think with a much more patient-centred approach, we are beginning to understand that better. We've still got a long way to go, but I think we are understanding that much better. That's an interesting question. Look, a couple of people that do come to mind, and they're both doctors who inspire me. I think they're wonderful leaders, and they've come from being clinicians, and one of them a clinician researcher, but into really a very strong leadership role and making a big difference to this state, in particular, Victoria. You can say even more than that. But one is the CEO of Safer Care Victoria. So Ewan Wallace, I think Ewan was, still is, an obstetrician, probably doesn't practice obstetrics, I'm not sure now, but he was an obstetrician, he was a researcher, but he was mainly a clinician, but he obviously had a clear idea about what high quality care was all about and what we should be doing to deliver high quality care. And he's now come in as the leader of Safer Care Victoria. And I think he's done a wonderful role and job in translating that into a language which is much better understood and appreciated by clinicians, particularly the medical profession. And so that is a wonderful thing to have done for our state and for our patients that we look after. So I admire what he has done and continues to do. And the other person is Sharon Lewin, who's the director of the Doherty Institute. And Sharon is an infectious diseases physician. I've known her for many, many years. Remember her well as a registrar and then as a consultant. And she's always, and a researcher, of course. And she has, through a number of leadership roles, but she is now the director of the Doherty, which is a collaboration between the University of Melbourne and the Royal Melbourne Hospital. And really she has managed to bring groups together and much greater than the sum of the parts, if I can put it that way. And she's enabled them to flourish and to make an enormous contribution, particularly through COVID, but even before that. And I think she has an ability to bring out the best in people, to acknowledge the contribution of individuals and of groups, and really to harness the energy of people to produce great work. So, and to really communicate it to the public and politicians and leaders what infectious diseases and what the work of the Doherty is all about. So they're two leaders that I admire who've come from the medical background actually, and I think have done great things. So there's so the technical side's easy, not easy, but there are lots of people who can do the technical side of things. But I think there probably are two other elements that I think are important, and therefore I'm sure I consciously look for. One is, and I have to be careful about this, but one is to think about it. How will this person fit in with our executive team? Because you bring an executive in not just to be the technical person, of course they come with a set of skills in a particular area that you need, but they also have an equally important role as being a member of our team, our leadership team of the organisation. And so if they just come with the technical skills and not the ability to fit into the team, not to be all homogenous and the same, but to work well as a team and part of the team and take on a leadership role, not just in their portfolio, but a leadership role of the organisation, then to me that's not going to work. So I always think about that, and it was always hard because you can't try before you buy. You have to try and sort that out and make a good decision about that. And so that's something I'm very, very conscious of. And the other is to make sure that they're always thinking ahead and something, I suppose creative is a word, innovative is a word that comes to mind, where, so not just doing that technical, but how, so for example, as people and culture, it's how will we tackle occupational violence? How will we but how do we create our leaders? So thinking differently and always thinking ahead and always trying to improve and do things even better, because the job is never done. This job is never done. So they're the two aspects that I think are important. First of all, don't be in a rush. So sometimes you meet young people and they're always worrying about leadership and how do I become a leader, and they sort of focus on that upward progression before really getting the basics right, if I can put it that way. So I think don't be in a rush, depends on your stage of your career, of course, but take your time. The second is, I think, if you're a clinician and to be a clinician leader and then go into, say, management, like I have done, then I think to have not as much clinical work as I did, I don't think you need that, but to have a very good base of clinical work before you go on into a management role is a good thing. I think you get credibility that way, that's important, but you generally understand the challenges that our healthcare workers have and the complexity of working in health. So I think some frontline work is excellent, and substantial amount is good. And then the second is to be brave, and that is be brave to take that next step when it's the time. And I contemplated doing an MBA and contemplated going to management probably quite a while before I ever did. And I always said, oh gosh, what if I fail? What if I fail? That wouldn't be any good. So I should have been braver, and I should have got going and somewhat earlier. Now that's a regret. How would life be different? I don't know, but that I just think in retrospect, I would probably left that too late. So there can be two extremes in that sense. But take on a role that maybe sometimes you might think, oh, that's a role, I'm not sure I really want to do that one, but it might be the one that's being offered to you, and that was my first step. I took the role no one else wanted, and then it went from there. So I think don't be in a rush. Having said that, be brave and take the next step when it's time. Get some clinical work under your belt if that's what you have as a background, and then don't be afraid just to take on the role that no one else wants, because you may well do very well and that'll be your big stepping stone.